day and welcome to Edu News. I am your host, Aira van der Voort. On today's news, we will be looking at the increasing amount of cases concerning corneal infection, more specifically amoebic keratitis caused by acanthamoeba. Acanthamoeba is a free-living protist that is found in the environment, an opportunistic pathogen. Acanthamoeba causes keratitis, a sight-threatening, painful, and difficult-to-treat ocular infection linked to the use of contact lenses. Acanthamoeba keratitis is a rare eye disease accounting for only 2% of corneal infections, but cases have increased. It is estimated that the incidence of this disease in developed countries is 1 to 33 cases per 1 million contact lens wearers. To tell us more about this infection, standing by is our anchor, Carmen Kelly, with one of SA's parasitologists.
Good day and welcome. We are here with UWC's Health and Wellness Clinic, and I am with Mr. Malik to talk about amoebic keratitis. Thank you for joining us, Mr. Malik.
Welcome, thank you for having me.
What exactly is amoebic keratitis?
Amoebic keratitis is a rare and serious eye infection of the cornea.
Can you demonstrate to our viewers where the cornea is located?
So the cornea is located in front where the clear part is.
What causes amoebic keratitis?
Amoebic keratitis is caused by Acanthamoeba species.
And how are acanthamoeba species transmitted?
So it can be transmitted via swimming in contaminated water or improper care of contact lens use.
When most patients hear about infection towards the eye or eye injuries, they are extremely scared as the resulting effect is blindness. Is that the case with amoebic keratitis?
Yes, advanced amoebic keratitis can cause vision loss or even blindness. However, mild amoebic keratitis and proper care, healthcare and treatment of the eye may not result.
What are the top common symptoms of amoebic keratitis?
So the common symptoms are watery eyes, difficulty of opening the eyelid, cloudy vision, and sensitivity to light, also known as photophobia. And the last one is the increasingly exquisite pain of the eye.
Thank you so much for your great insight, Mr. Malik.
Welcome.
More on amoebic keratitis from our scientists. This is Edu News. I am Carmen Kelly.
Okay, the symptoms of acanthamoeba keratitis are 1. Chronic progressive ulcerative keratitis, 2. Perforation, 3. Severe ocular pain, and 4. Which is the affection of vision. In HIV patients, acanthamoeba keratitis causes inflammation of the ocular cavity.
We cannot conclude that this is acanthamoeba keratitis based on the symptoms that were presented. So we have to do a microscopic examination, which consists of 3 methods: a saline wet mount, iodine wet mount, and buffered methylene blue. In order to perform the wet mounts procedures, you have to take your microscope slide and label it with the patient's details. On the half left side, you add a saline. It must be warm if ever you suspect trophozoites, and then you add an iodine on the right side of the slide. Then you each add a sample on both sides, and then you put a cover slip on top of it, and then you go and view it on the microscope. If ever you see the trophozoites, you perform a buffered methylene blue, which is the same procedure, but then you add buffered methylene blue, and then you view it on the microscope.
Adhesion of the microbe to the surface of the host tissue is a critical step in the pathogenesis of amoebic keratitis infection. A major virulence protein is expressed, mannose-binding protein MBP. This mediates the adhesion of amoeba to the surface of the cornea.
There was some great information from our parasitologists and scientists telling us about the symptoms and how to go about diagnosing acanthamoeba keratitis. Up next, we have a doctor to tell us about the treatment and prevention, and end the show with the weather.
Since Acanthamoeba keratitis, a free living organism, it can be isolated from many settings, such as public water sources, swimming pools, freshwater reservoirs, saltwater, hot tubs, ventilation ducts, soil, bottled water, and even eye wash stations. This condition can be intimately linked to contact lens use, as it is a significant risk factor. Contact lens wear is the most common factor. People without contact lenses can also be affected. This can be if the disease is not treated efficiently and aggressively, it can result in vision loss. The factors that contribute to the pathogenicity of this disease is the wearing of contact lenses in contaminated swimming pools, inappropriate care of contact lenses, and the use of homemade saline for cleaning the lenses. The treatment of this care, in order to treat this disease, you can use the oral itraconazole and also the topical miconazole. Depending on the severity, a corneal transplant might be needed. The polyhexamethylene biguanide and the chlorhexidine have been also reported to be the most effective drugs for the treatment of the infection, and in combination they have been reported to be effective against both the cyst and the trovozoites. In order to prevent this disease, you must avoid the use of contact lenses while swimming. You must practice appropriate cleaning techniques for contact lenses. Avoid swimming in contaminated water, and you have to be assured that there is proper chlorination of the swimming water.
Good day, I'm Davian Carolus, your weatherman of today, and I'm here to provide you with important news regarding our weather. We've been alerted by Amoebic keratitis infection that occurs by the Amoeba keratitis parasite, and it causes infections globally, especially in your America, Europe, and Asia countries. Most of these infections caused by the T4 genotype of this parasite cause infections in your Asia and Europe countries. The main vectors of these infections are your food, your sucking blood insects, ticks, and your amoeba parasite himself. So, the environmental reservoir of this infection will be your soil, dust, fresh water, resources such as your lakes, your even seawater can cause this infection. So, people working with food, it will be best to practice good hygiene to prevent this infection. Also, if you're going for a swim, especially during the summer, people please, if you're wearing contact lenses, make sure that you are not wearing contact lenses when you go for a swim, due to the fact that this infection causes most of the infection in people wearing contact lenses. So be alert of this infection, practice good hygiene, make sure that you are not swimming in contaminated water, especially at home in pools and also in your seawater, to prevent this infection and also stop the spreading of this infection that causes so much parasitic infections, not in these 3 countries, but also globally. Be safe and let us stop the spread of this infection.
That is all we have today on Acanthamoeba keratitis. I am your host, Aira van der Voort, and this has been Edu News.